topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Tennessee. Welcome to another Ask the Expert show where we bring you the finest experts in the field of legal, health, financial, and home improvement. I got to tell you, this next expert, we got so lucky. We get so many questions because we have an older demographics. We get so many questions about Medicare and about hearing aids and about vision. And we got the finest Vision Institute in Tennessee. We have the Wang Vision Institute. We were so lucky to get them, and it's amazing. We get more questions on cataracts, unbelievable amount of cataracts, and we'll be talking about eye health care today, as well as cataracts. Let me welcome you to one of the finest doctors when it comes to eye surgery, our Dr. G. Good morning, Dr. G.
Hey, good morning. Good morning. Thank you for having us, Steve-O, on that introduction.
I've missed you, bro. I got to tell you. I've missed you.
For a while.
I know it has been, but hey, we are so excited that we have Wang Institute, and we get so many. I was telling your marketing director, we get so many letters just thanking us for your show, your knowledge. It is so amazing. Hey, when you came out of medical school, did you know you were going to go into be an ophthalmologist?
Yeah, good question. So actually, when I first started medical school, I thought I was going to be a cardiologist. So my very first paper I published is on what's called electrophysiology. But then as I got into my rotations and everything, I realized it's not for me. I really like the eyes because, I can diagnose the problem medically and I can treat it surgically. So it's not like I have to refer to multiple different people. I can kind of do everything in-house. I can see the problem. I can visualize the problem. So my background is in biomedical engineering and mathematics. And so ophthalmology is very objective. All the lasers that we do, all the surgeries that we do, they're very precise. I can put in exact numbers. I can exactly quantify how to fix things. So it's more quantitative rather than qualitative.
I have to ask a question because we have been inundated by emails from our listeners. There is a commercial going on out there. It just sounds too good to be true, and people want to know if it's real or not. There's supposedly I think it's out of Japan, eyeglasses that can change from nearsightedness to farsightedness. And it can, when you go outside, protects you from the sun. Is that really true?
Yeah, so what you're referring to are called adjustable glasses. And it's actually not something that's new per se. Maybe this one's just being marketed a little bit differently. But there are newer iterations that are coming out where it's supposed to be a little bit better. But with the current technology, the ones that have come out, the feedback that we've gotten is really they don't work that great. They are attempting to kind of recreate the vision at different focal lengths, but the current adjustable ones, patients have to manually kind of change it. It doesn't automatically do it. So they kind of click a little button on their glasses and it kind of changes it. These newer coming ones, and I think kind of in the future, they're going to be using kind of real-time feedback from like a video monitoring system. So the glasses are actually recording it, and then they're mapping that image onto your retina to determine what power to change the glasses. So that is something in the works. But right now, I don't know of a very good commercial product to really recommend that.
Okay, I'm so glad you said that. We're going to be talking about eye health today and cataracts. And I'm so glad we're talking about cataracts because we get so many questions from our listeners about cataracts. But before we start, tell people about Wang Vision Institute.
Yeah, so we are a cataract and refractive surgery practice here in Nashville, Tennessee. We've been in practice for about 20 years. So we do about 8 different surgeries to help patients out of glasses. Just really depends on your goals, your prescriptions, your hobbies, your age. So our bread and butter is cataract, refractive cataracts, but we also do Lasik, smile, implantable contact lenses. We're kind of one of the premier institutions in the area. We have access to all the latest technology and advances in ophthalmology.
When we think of eye health, Dr. G, diabetes comes to mind, glaucoma. Why is eye health often called the window into overall health, especially for conditions like diabetes and high blood pressure?
Yeah. So, one fun fact I like to tell patients is the eyeball is the only part where I can look through and see part of the brain without having to image you or anything. So when we dilate patients and we look through that pupil, we are able to see the retina and the optic nerve. So the optic nerve is a cable that connects to the brain. So we're actually seeing into the opening of the part of the brain. So similarly, we call it the window because taking a look at that retina, that optic nerve can give us an idea of how someone's overall health is. If someone's optic nerve is pale or lacking color, they might be having alcohol abuse. They might have nutritional deficiency. We can tell that. If they're having bleeding in the retina, they might be having high blood pressure. They might be having diabetes. In fact, I did my dad's eye exam and I found a little finding. So I told him, hey, go see a cardiologist. He had no other signs or symptoms, but when I looked at his eyes, I found a little change in his vasculature. Just like we get moles on our hand, we can get moles on the retina, the back of the eye. So really, whatever is happening in our body is also happening into our eyes, and we get a clear view into the picture of the retina and the optic nerve to see what's happening.
So you can actually look into the eye and tell someone if they have diabetes?
Yes, 100%.
Wow.
100%. Diabetes, high blood pressure, and this is in the future, and this is kind of coming out in the works, but people are even doing scans of the retina to see if they could be predictors for Alzheimer's.
Wow.
Just depending on how fast that tissue is thinning and looking. Exactly. So we can tell a lot by just looking into the eye.
Is AI going to have any influence on the eye at all?
I think AI will help with the imaging processing and kind of providing accessibility. So a lot of the ways that we diagnose diabetes, high blood pressure in the eye is by visualizing and looking at the retina. And so now we're able to feed all these retinal images into AI. It's able to kind of review images for us and say, hey, this person is suspicious for diabetes. Hey, this person is suspicious for high blood pressure. So what really this will allow people to do is get a lot more access to care, because we can put a camera, next to like the CVS blood craft machine, and the camera would just take the photo, and then the person would just put in their email, and if there was something wrong, somebody would reach out to them. So it's going to help access care. And then kind of like what I was talking about, it's going to help with all that visual processing, analyzing the retinas of people with different diseases to see if people with dementia, Alzheimer's have different kind of retinal changes before they detect it in the body, before they have mental changes.
Dr. G, how does diabetes affect the eyes, and why is diabetic eye disease sometimes missed early on?
Yeah, good question. So, diabetic retinopathy is what it's called. So diabetes is one of the leading causes. Diabetes, macular degeneration, glaucoma, and cataracts. These are the four most common causes of blindness. So diabetes, just like how it can affect your heart, cause a heart attack, just like how it can affect the brain, cause a stroke, same thing can happen in the eye. It can affect the blood vessel perfusion, and it can cause bleeding in the eye. It can cause vision loss in the eye. It can cause a stroke in the eye. It can cause double vision to occur in the eye. It can cause the cataract to grow faster in the eye. So essentially what diabetes is doing is decreasing blood flow to the overall eye. So as a consequence, it can create a lot of ischemia and kind of cause secondary effects. With later stages of diabetes, people need injections or lasers. So with diabetes, we recommend if you're diabetic, pre-diabetic, come in for an eye exam, because the earlier we can catch it, the earlier we can say, hey, you've got to control that diabetes faster.
It's so amazing where your industry has gone to. What is macular degeneration? How does it impact everyday activities like reading or driving?
Yeah, so macular degeneration is a disease of the retina. Again, it's one of the leading causes of blindness. What it really does is starts to affect the central vision of your eye. So people will start to notice maybe wavy or distorted lines in their vision, or they might have a central graying or a central blur, and outside on the periphery they could see, but in the middle it's really gray or cloudy. So there's two kinds. There's called dry macular degeneration and wet macular degeneration. For dry macular degeneration, until recently, really there hasn't been many treatments. It's just a slowly progressive condition. Some people can take a vitamin which can help reduce the progression. With wet, what happens is there's actually even fluid buildup that occurs in the retina. So the retina is that film to the back of the eye. That's where all the rods and cones are that process that signal. So fluid will build up in that retina, and then people need injections to reduce that fluid so that you can see a little bit more clearly.
Martha in Brentwood wants to know, what a great show. My mother actually is a patient of yours. She said, I want to know what causes dry eye and how can you treat it?
Yeah, good question. So dry eye is a chronic disease. It's kind of like the back pain of medicine. A lot of things can cause it, and a lot of people are affected by it. The older we get, just kind of like our skin dries out, so do our eyes. So tear production goes down, and how fast our tears evaporate go down as well. Things that you could really do at home as kind of maintenance is, with the advent of screens and technology, people dry out a lot faster. So we have something called the 20-20 rule. So for every 20 minutes of screen time, you want to look at something 20 feet away for about 20 seconds. Warm compresses can help open up the oil glands in your eye so that the oils flow more freely, so they don't evaporate as fast. You can use some high quality artificial tears like Refresh or Sustain, which can help lubricate the eye. But beyond that, if you're still having symptoms of foreign body sensation, gritty feeling, it's always good to get evaluated. So we can do a few things, such as what are called plugs, and we can also do what's called an amniotic graft. And then we also have various different procedures, so like IPL or thermal pulsation devices, so that actually treat the cause of dryness. So it'll help open up all these oil glands. So it really just depends on the extent of how symptomatic you are.
Do you treat that with drops?
Yeah, so first line therapy is to treat it with eye drops, the over-the-counter artificial tears. And if that doesn't work, we do prescription eye drops. And then, the highest level of eye drops is what are called serum tears. So sometimes we have to send patients to a lab where they'll take their patient's blood, spin it down, and turn it into artificial tears for them. So.
I was reading the other day about glaucoma, and they said it's called the silent theft of sight. Why is it so dangerous?
Yeah, so glaucoma, yes, as you noted, it's called a silent disease. So it's called a silent disease because it starts to affect your peripheral vision. So by the time patients even notice that some of their vision is missing, they've already lost a lot of it because now they're actually noticing it. So meaning it's starting to affect more and more centrally. So glaucoma is a disease of the optic nerve. The optic nerve is the cable that connects the eye to the brain. So one of the reasons we really recommend annual eye exams is because we can screen for glaucoma. Patients really don't have symptoms until it's too late. So when we screen for glaucoma, we check your pressures. Sometimes high eye pressures can cause glaucoma. And then we take a look at that optic nerve tissue to make sure it's healthy. Once you're diagnosed with glaucoma, it's a chronic condition, and we want to do everything we can do to slow down the progression. There's no treatment, there's no cure. There's no cure to reverse loss that's already happened. So we want to make sure that things don't get worse.
This is from Chase on our chat line. Is it only through dilation you can see this much, or can you see it just looking at the eyes? It's probably one of our past questions.
Yeah, that's a good question. I mean, without dilation, there's still some changes that we can see. When we look at the front part of the eye, we can tell, if you're at high risk for what's called angle closure glaucoma. We can tell if you've got a history of previous inflammation. We can tell if the eyes are really dry. And even without dilation, we can still look through that small pupil to look at the optic nerve. So we kind of use both parts of the exam, the dilated exam and the undilated exam, to kind of take a look at overall health.
With glaucoma being so dangerous, they should have it first of all, is there an age demographic that you see? Is it an older demographic?
Typically, so glaucoma in of itself, there's multiple subtypes of it. So it really just depends on the subtype, but the most common one is called primary open angle glaucoma, and that is typically seen in patients that are a little bit older, patients with a family history. But there are, conditions where even young people can develop glaucoma.
Wow. What about, we haven't really touched on cataracts, and I know because talking to friends of mine, that is definitely an older demographic.
Yes.
When should someone make an appointment to see you? To first of all, find out if they have cataracts or not. I know what it's like because I started seeing this at night. I noticed it most of all at night, and lights would be like a star bright.
Yes, that's kind of a classic description. So, just like a camera has a lens, our eyeballs have a lens inside of the eye. That lens does two things as we age. One, it gets more and more stiff. That's when we kind of lose the ability to read without readers or bifocals. And then over time, that lens will also start to become gray, cloudy, opaque, kind of like our hair. That's what we call a cataract. So that lens, when it becomes really gray and cloudy, that's when patients have symptoms of difficulty driving at night. They get the glare and halos at nighttime. They get reduced vision and dim, foggy conditions. They're going to keep changing their glasses, but their vision is still poor. So if you're having any of these signs or symptoms, it's time to get evaluated. Cataracts are graded on a scale of 1 to 4 plus, 4 being the worst. And ideally, you want to have surgery kind of when they're in that 1 to 2 range. Once they get to that 3 to 4 range, the surgery becomes harder.
When there's so many things that involves the health when it comes to the eye, what all do you look for when someone comes in for an eye exam?
Yeah, so when someone's coming in for a general eye exam, we're kind of doing an undilated exam and a dilated exam. So we're looking for things like dry eye. We're thinking just like people get moles on their hands, you can get moles on the colored part of the eye. You can get moles on the back part of the eye. And most of the time they're benign, but some can be malignant. So we're screening for any dangerous moles. Same thing with the eyelids. We're also looking at the eyelids. Some people have really turned out eyelids, turned in eyelids, puffy eyelids, and a lot of these can be fixed. People, as we get older, the eyelids get much heavier and it reduces our visual field. But we can do that to reverse that. And people like with sleep apnea, they'll have their eyelids turned out. So sometimes, just like I can look at the retina and tell if someone has diabetes, I can look at people's eyelid and know if they have sleep apnea or not. So their eyelids become very loose and lax, what we call them. Beyond that, we're looking at conditions like cataracts, glaucoma, macular degeneration, diabetes. So these are all things that we look at.
Amazing. I'm so blown away. We just got a text in. Somebody wanted to know, do you do cosmetic work?
We do a little bit of cosmetic work. So in terms of cosmetic work, what we do is what's called IPL, intense pulse light therapy. Also, some practices call it BBL. A lot of plastic surgery offices, dermatology offices have this. What it is it's just a light therapy that really gets rid of all the facial redness. It was used to, especially for people with rosacea, sunspots, hyperpigmentation. But the device that we have also has a little probe where we can actually even treat the eyelids. So other offices, they're afraid to do the eyes, but we also do the eyelids, and it's been shown to really help with dry eye. So with the IPL, you get a cosmetic benefit and a dry eye benefit with it. And recently we adopted what's called low light therapy, which is essentially industrial grade red light therapy. So that helps with skin rejuvenation. And aside from that, we also do Botox kind of for the forehead lines, crow's feet, and the 11s. We do a few eye drops, one to help eyelashes grow. Called Latisse. And then we also have a different eye drop that can cause a lid lift. So people that have droopy eyelids, don't want to quite have surgery, but want to have a little bit more lift, we have an eye drop for that as well. And then beyond that, we do a lot of surgeries to help patients out of glasses.
Wang Institute is so amazing. Tell people how they can reach your office.
Yeah, you can, our phone number is 615-321-8881. You can visit our website at wangvisioninstitute.com. So on our website, you could also find a way. There's our email address. You can directly email us. You can directly contact us. But the phone or the website is always the easiest way.
Dr. G, have a wonderful holiday. A happy new year.
Thank you.
And wish Dr. Jones happy holidays from us too. And we'll see you all next month.
Yes, you as well. Thanks, Devo.
Thanks, Dr. G. That's Dr. G of the Wang Eye Institute in Nashville. That's going to do it for us today. We'll be back again with you next week. Everybody have a wonderful Christmas. And please take care of yourself. We'll see you soon.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.